Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you are all fine and doing well for your RRB exams. So daily we are posting 5 important MCQ for the nursing competitive exams. Today also we are going to see 5 important MCQ for the competitive exam. So last class we have seen the triad part 1, triad symptoms. Today also we are going to see the triads part 2. Okay. So triad symptoms. So most of the diagnoses have the particular triad symptoms are there available. So we are going to see that part. Okay. The first question, hypoglycemia during attacks, resolution of symptoms upon correction of blood glucose, symptoms brought about by low glucose states are seen in which triad? So the options they have given, Murphy's triad, Whipple's triad, Rigler's triad, Virchow's triad. So the correct option is Whipple's triad. So correct option is Whipple's triad. So it is related to the insulinoma. So when the person having the high insulin secretion due to the tumor, insulinoma, so the patient will have these kind of symptoms. How can we remember the Whipple's triad? Just remember H2G. Okay, H2G. So H means hypoglycemic symptoms. First G, the glucose level will be less than 50 mg per deciliter. And second G is glucose ingestion gives symptomatic relief from the hypoglycemia. So this is called a Whipple's triad, mainly seen in the insulinoma. So according to this scenario, it's matching with the option B, Whipple's triad. We will see other options also, Murphy's triad, what is Rigler's triad, what is Virchow's triad. So Murphy's triads, nothing but it is related to the acute appendicitis. So what are the Murphy's triads? Pain in the right iliac fossa, vomiting, temperature. This is Murphy's triad. And one more triad also we have seen in the acute appendicitis in the last class. What is that? Do you remember that? Yes, that is Duolophis, Dilophis, okay, Diolophis triad. What are they? Hyperthesia of the skin, okay, that is hypersensitivity of the skin, and exquisite symptoms, tenderness and guarding over the McBurney's point. That is called Duolophis triad, okay, Dilophis triad, that is seen in the acute appendicitis. So two triads are related to the appendicitis. One is Murphy's triad, next one is Dilophis triad, okay. So these are the two symptoms which relate to the acute appendicitis. Next is Rigler's triad. What is Rigler's triad? It is a gallstone ileus related triad. So what are the symptoms which can seen in the Rigler's triad means pneumobilia. That means the biliary tract will have air accumulation. That is option 1. You can see it here. The bile duct will have the air. That is pneumobilia. Next is ectopic gallstone. The gallstone outside the gallbladder because seen in the X-rays. If you do the X-rays, the gallstone will be seen in the other than the gallbladder. Okay, that is option B are telling here. So you can see the gallbladder stone outside the gallbladder. So that is also the triad of Rigler's. Next is intestinal obstruction. Mainly the small intestinal obstruction you can see. So these three comes under Rigler's triad seen in the gallstone ileus. Clear? Yes. Next is Virchow triad. So mainly we can see it in the DVT patients. That is Virchow triad. What are the Virchow triads telling? Stasis, vascular damage, hypercoagulation. These three comes under Virchow triad. Stasis lead to cardiomyopathy, vascular damage lead to vasculitis, hypercoagulation. The clot formation will lead to stroke and pulmonary embolism. Okay, it is mainly related to the DVT. Clear? So we have seen 4 triads, Whipple's, Murphy's, Rigler's, and Virchow triad in a single question. Clear? Yes. Next, what is unhappy triad? Question number 2. What is unhappy triad? So unhappy triad related to what? Options: knee injury, depression, lung injury, mania. So the correct option is knee injury. Okay, don't think that in unhappy means it is related to the psychiatric. Unhappy triad is related to the knee injury. It is otherwise called O'Donoghue triad. Unhappy triad otherwise called O'Donoghue triad. It is related to the knee injury. So what is happening here? there is an injury to the meniscal tear and ACL and MCL. You can remember MAM, mnemonic. Okay, MAM, mnemonic. M for medial meniscal tear, ACL, A, anterior cruciate ligament tear, MCL tear, that is medial collateral ligament tear. So 3 tears are happening. Clear? So it is related to the knee injury, unhappy triad or O'Donoghue triad. Okay. So it is not related to the depression or lung injury or mania. So next question, symptom of Trotter's triad are. They are asking about Trotter's triad. The options: hematuria, palpable abdominal mass, flank pain, estimation of HCG, estriol and AFB, growth retardation, edema, mental retardation, conductive deafness, immobility of homolateral soft palate, trigeminal neuralgia. So what is Trotter's triad? It is related to the option D, conductive deafness, immobility of homolateral soft palate, trigeminal neuralgia. So what is Trotter's triad? It is otherwise called Morgagni syndrome. Morgagni syndrome. So what is that Morgagni syndrome? When the patient is having nasopharyngeal carcinoma growth superiorly, they will have these 3 symptoms. That is called Trotter's triad. It is seen in the nasopharyngeal carcinoma. Conductive hearing loss will be there. Palatal palsy. Okay, palatal palsy. Patient immobility to move the lateral soft palate and then trigeminal neuralgia. So these are comes under Trotter's triad. What is option A? Hematuria, palpable abdominal mass, flank pain. It is related to the renal carcinoma, renal tumor. Option B, it is triple test to diagnose Down syndrome, estimation of HCG, estriol and AFB. What is C? Growth retardation, edema, mental retardation. It is Korsakoff. Clear? So the correct option for the Trotter's triad is option D. Clear? Yes. Next, question number 4. Iron deficiency anemia, dysphagia, esophageal webs are related to which triad? Iron deficiency anemia, dysphagia, esophageal webs are related to which triad? Options: triad of Plummer-Vinson syndrome, triad of Wernicke encephalopathy, triad of renal cell carcinoma, triad of aortic stenosis. So what is the correct option? The correct option is option A, a triad of Plummer-Vinson syndrome. So what is Plummer-Vinson syndrome? It is either a genetic disorder or a nutritional disorder. The patient will have iron deficiency anemia. So patient will have the chelosis, angular stomatitis, glossitis will be there. And iron deficiency anemia will be there. Esophageal webs will be there. Okay. Studies comes under Plummer-Vinson syndrome. What is the triad of Wernicke encephalopathy? This is triad of Wernicke encephalopathy. That is due to the vitamin B1 deficiency, AAO. Remember the mnemonic AAO, altered mental status, ataxic gait, ophthalmoplegia. So what is the triad of renal cell carcinoma? We have already discussed in the previous slide. Hematuria, palpable abdominal mass will be there, flank pain will be there. So what is the triad of aortic valve stenosis? SAD. Remember the thing SAD. Syncope, angina, dyspnea. It is aortic valve stenosis triad. Okay. Here are once again we have seen 4 triads in a single question. Triad of Plummer-Vinson syndrome, triad of Wernicke encephalopathy, triad of renal cell carcinoma, a triad of aortic stenosis. Clear? Yes. So last questions today's symptoms of trauma trial of death. Symptoms of trauma triad of death. So they are asking about triad of death. The options: coagulopathy, hypothermia, acidosis, respiratory depression, pinpoint pupil, CNS depression, renal failure, edema, hypocalcemia, fever, right lower quadrant pain, and vomiting. So what is the correct option? The correct option is option A, coagulopathy, hypothermia, acidosis. When the patient is undergoing a death process, they are about to die. So what are the symptoms we can expect? So coagulopathy, okay? Coagulopathy, lactic acidosis, the anaerobic metabolism is getting high, right? And then decreased myocardial perfusion, that is leads to hypothermia. Clear? That is the option, correct option for the trauma triad of death. And You have to comment in the comment section what is option B is telling. Okay. Let me see who are all interested people's putting the comments. Let me see. Option B, respiratory depression, pinpoint people, CNS depression. These are the triad symptoms of which disease, okay, or which it's related to which one, okay? You have to comment. Next, option C, renal failure, edema, and hypocalcemia. It is chronic renal failure. Option D, fever, right lower quadrant pain, vomiting. It is related to appendicitis. Option B, please comment, okay, in the comment section. Okay, that's all about today's class. Thank you so much. I hope the class was helpful to you. I'll meet you in the next class and all the best for your exams.